Just email your photo to showusyourmug@wrcbtv.com. Watch for our winner each weekday morning on Channel 3 Eyewitness News Today.
If you or someone you know has been facing surgery in the midst of COVID, no doubt you've had lots of questions and probably some concerns, in addition to what would be typical along the way. At the Center for Sports Medicine, they are happy to be able to provide you outpatient surgery in areas where otherwise folks would find themselves in the hospital. Dr. Benji Miller joins us this morning. He's here talking about total joint outpatient surgery. Good to see you.
Good morning.
So we're talking hips, knees, shoulders. There was a time when that was a major surgery requiring, it seemed, days in the hospital. That's no longer the case?
It's still a major surgery, but we've advanced to the point where we can do outpatient total joint replacement safely now. That's changed over the last few years all across the country, and it's here in Chattanooga as well. And we've been doing it for a few years, but over the last probably year, we've done more volume outpatient and done it safely.
So not to make you get too into the weeds with us here, but what has changed to allow you to do it outpatient? Is it your surgical technique, or is it the equipment going in?
The techniques are the same, but pain control has improved. I think just the culture has improved as far as people wanting to be outpatient and wanting to recover at home and wanting to recover a little bit more quickly. So I think that there's multiple factors that have pushed us this way. Cost has been a factor as well. It's more inexpensive to do an outpatient total joint, so many patients are drawn to that. And it's and many studies over the last few years have shown it to be just as safe, if not safer. So that's driven it as well.
You mentioned the pain control. That's a big benefit that you found ways to help manage that pain, because that can be a real trial and error sometimes for people when they go home from a procedure.
Absolutely. So a lot of times the anesthesiologist on our team will help us with sometimes nerve blocks, sometimes special medications that are longer acting that can really help us control people's pain. And a lot of times we can give them the same oral pain medicine as they would get in the hospital. So not a lot changes as far as the pain management in the hospital versus at home. But the nerve blocks and the special injectable medication has really improved pain control for us.
Is this becoming a crunch time for you at the office because people perhaps are trying to get these procedures in by the end of the year?
Yes, toward the end of the year, everybody has used, a lot of times have met their deductibles, so it's a little bit busier for us at the end of the year. That has changed a little bit with the virus, but it's still, we've seen an increase in volume over the past couple months.
I've talked to enough of your doctors over the years to know that the answer to my question before I ask it, but I'm going to ask it anyway. People watching who think, yeah, but what if I go in there and they just recommend a surgery for me when the truth is I could go through some physical therapy first? Do you jump into a surgical fix right away?
No, we almost never do. And there's many things you can do, non-surgical, including physical therapy, like you mentioned, medications, injections, activity modifications. There's a large list of things that we will go through before we get to the surgery discussion. And
I think that I know that early intervention certainly is key. If you can begin those alternative treatments earlier on, the better off you are. So a couple of minutes left. For folks who might be afraid of coming in because of COVID, can you do some of this via telehealth?
Absolutely. We've started telehealth at the beginning of this virus, and we're doing a large percentage of our visits, telehealth, if possible, especially follow-up visits. And post-op, in some situations, post-op visits can be follow-ups. We can go over imaging studies through follow-up and through video. So a lot of these visits can be done remotely.
Well, I know you've got patients there waiting to come in and see you, so I'll let you wrap things up. But thank you so much for your time this morning.
Thank you.
Dr. Benji Miller at the Center for Sports Medicine, their main office down there on Macaulay Avenue. Phone number 624-2696, online at sportmed.com. All of those outpatient surgeries are happening at their surgery center at their downtown location. We're back with more 3+U in just a minute.
It's Ashley Home Store's Black Friday Deal Days. This week only, save 30% off your first item and 20% off the rest of your purchase. Plus, don't miss special deals each day.